Okay, so this is Piglet. He is a 5.5-year-old domestic long hair. He's a neutered male, and he is less than thrilled to be with us tonight, but he is going to be our little model for an oral exam. I'm just gonna offer him a treat, sort of earn his happiness, but I think we're past that at this point. So what we're gonna do for the oral exam, it's just an internal oral exam today, is have a look at his teeth, lips, his gums, which should be pink and moist, and we'll assess the moisture, do a capillary refill time, look at his tongue, just check for masses, missing teeth, foreign material that doesn't belong there, check for calculus, gingivitis, and just note what teeth are affected if there are any teeth affected. So I'm just gonna place, I've chosen just to do this by myself tonight because having one handler sometimes puts a little less stress on the cat than adding a second handler. So hopefully he will let me do this just with one hand on the top of his maxilla here and the other hand on the mandible. So I'm just gonna get a look in here. Just lifting up his gums, looking at his teeth. So his skin is a little on the darker side, so it's not quite as pink as you would necessarily think of it as being, but it is nice and moist. He does have a capillary refill time of under 2 seconds. There's a mild amount of buildup on his teeth, but for being 5.5 years old, no significant calculus and certainly no gingivitis. So that's really good. The next thing I'm gonna do, if he'll allow it, is just try to get one finger over top of his tongue so I can look at the structures in the back of his throat, which he was really good for. And then just try to move his tongue over so that I can have a look underneath it. Yeah, good boy. And then one more look just kind of to the back of his mouth. All of his teeth look really good. He's starting to get a little flustered. I'm just gonna spin him around so I can look at his teeth on both sides. I know, buddy, good boy. All in all, he was a really good patient. His mouth looks really good.